So welcome everyone. Thank you for joining us for our Northern Light Health Good Health is Good Business Zoom conference. While summer may not officially end until September 22nd, for many of us, the start of school marks an official transition to fall. So I hope you all found time to enjoy your summer while also appreciating Maine's four seasons as much as I do. Today, following an informative presentation that will address the emergent health news we are hearing and reading about, we will discuss the topic of workplace violence. Workplace violence, as defined by the Occupational Safety and Health Administration, is any act or threat of physical violence, harassment, intimidation, or other threatening disruptive behavior that occurs at the worksite. Employee, patron, patient, and student safety have certainly always been a top priority for employers. Resources and various tools have been available for years. But like many things, the pandemic has brought the topic of workplace violence to the forefront. We have been hearing reports of violence on airlines, fatal shootings at work sites and schools across the country, and escalated violence in the healthcare setting. The reports seem to be endless, and the realities of today's world are requiring all of us to respond in new ways to ensure a safe working environment. I'm Karen Hawks, Vice President of Operations at Northern Light Beacon Health, and I'll be your moderator for the next hour. Please join me in welcoming our expert panelists today. We have Dr. Jim Jarvis, Senior Physician Executive and System Incident Command at Northern Light Health and Director of Clinical Education for Northern Light Eastern Maine Medical Center. Rand O'Leary, Senior Vice President at Northern Light Health and the President of Northern Light Eastern Maine Medical Center. Kelly Weaver, School Counselor for RSU 22, the school district that serves Hamden, Newburgh, Winterport, and Frankfort. Amanda Cost, Executive Director at Partners for Peace, and Chris Laird, a registered nurse and Associate Vice President of Patient Care Services at Northern Light Eastern Maine Medical Center. Before we get started with today's panel discussion, I will read our legal disclosure. The corona pandemic is an ongoing, continuously evolving situation. Northern Light Health encourages everyone to follow federal and state governmental guidance and mandates. The information presented in this session is provided for educational purposes only and is not meant to substitute professional or medical judgment. Northern Light Health does not know the particulars of your situation, so the information presented today is intended to be general in nature and may not apply in every individual situation. Northern Light Health and the presenters make no guarantees or warranties regarding any information provided. And now that we have that underway, let's remind you that this hour is intended for you, and we welcome and encourage your questions at any time using the question and answer function. Also, I hope each of you will take a few minutes immediately following this hour to answer our quick 5-question survey. Your input directly affects our topics and helps guide our future conferences. As promised, we will begin today's discussion by asking Dr. Jarvis to provide additional information about the recent health news we are reading about in the headlines. So welcome, Dr. Jarvis. Thank you for joining us.
No, thank you, Karen. So really the biggest news that I have to talk about is a COVID vaccine update. And it's been a while since we've updated anything on vaccines, so I'm happy to be able to do that. Recently, both the FDA and the CDC authorized 2 new messenger RNA vaccine formulations for use as booster shots against the virus that causes COVID-19. These are known as bivalent vaccines because they contain components that develop immunity against both the original strain of the SARS-CoV-2 virus and an element that's common to the Omicron variants of BA4 and BA5, which are the dominant strains right now across the United States and pretty much around the world. So that's great news for us because we now have a booster shot that's specific to Omicron variants, which we know is really what we kind of think is going to be the leading cause of disease going forward. Of the 2 vaccines, the Pfizer is authorized for those who are 12 and older, and Moderna is authorized for those who are 18 and older. The booster shots should be administered at least 2 months after the last COVID vaccine administration. So if you've just finished your primary series or you've gotten a prior booster shot, you need to wait at least 2 months before you get this particular booster shot. Next slide, please. Individuals who had a recent infection can certainly get the booster shot once they're out of their quarantine period, but there is some data to suggest they may want to wait up to 3 months from their initial symptoms or a positive test because it actually enhances the effectiveness of the particular booster. That might be a discussion you want to have with your particular provider, especially if you're in one of the high-risk categories. I do want to say that the new boosters do not have any data yet for use in humans, though there were some bivalent vaccines that were tested prior to these two being developed. It's just that they were tested on variants outside of the BA4 and BA5, and so they were kind of updated. But they use the exact same technology and are similar to the vaccines that have now been administered several billion times to individuals around the world. And so we do feel that they will be just as safe from their profile. And as far as effectiveness, we feel they will be even more effective than the ones used before. Just a reminder that the annual influenza vaccines are altered versions of prior vaccines and similarly are not tested prior to their authorization for use. In fact, we've been doing that for decades because once we know the safety profile, we can alter them without having to redo those safety things. For the initial vaccine series, the original Pfizer and Moderna messenger RNA and the Novavax vaccines are still being used for those. And for more up-to-date information, you can certainly go to the cdc.org website. Some other health-related updates: annual flu vaccines. There are some strong indications that this will be a high influenza activity season for us. We get that data really by looking at some countries in the Southern Hemisphere, particularly Australia. It's usually a bellwether for what we see in the United States. And they have had a very bad influenza season along with COVID-19. So we recommend that anyone over 6 months of age should get vaccinated against influenza because we want to make sure that we don't have, again, that double whammy of dealing with COVID and dealing with influenza cases that could overwhelm our healthcare systems. Really quickly, update on monkeypox. The worldwide incidence of new cases is falling. That's good news. I think that has to do with a lot of the efforts made around the globe to warn individuals that this is a risk and to mitigate that. There are still only a few confirmed cases here in Maine, but we do suspect there are probably more individuals who just have undiagnosed cases at this time. But it's good news to know that we continue to remain at a low incident case. And then, of course, we have vaccines and treatments that are readily available across the state. And you can go onto our website or the Maine CDC's website for more information on that. And with that, once again, we'll just show you where you can go to learn more about the vaccination schedules here at Northern Light Eastern Maine Medical Center and across Northern Light Health. And I'll turn it back over to Karen.
Thank you, Dr. Jarvis. And just a couple of follow-up questions. Do we have the new booster available yet in Maine?
So we do in a few commercial retail national pharmacy chains, but our health systems receive their vaccines through the state allocation system, and we expect them to arrive at any moment now. Actually, sometime this week, we expect that those will arrive on our doorstep. And we hope that we'll be able to start administering those booster vaccines next week. Again, please follow our social media pages and listen to other media outlets for updates on that. It's kind of one of those ever-changing things because this was a very rapidly developed situation.
And I know that given it will be available soon, hopefully through the healthcare systems, is it safe to get the flu vaccine as well as a COVID vaccine on the same day?
It is, and in fact, in some cases, we highly recommend that happening so that we don't, you can avoid 2 trips, but it's perfectly safe to do that. We are already administering influenza vaccine for some individuals in our practices right now, and then hopefully we'll be able to add the COVID booster real soon.
Great. Well, appreciate the update, Dr. Jarvis. If there's any questions for Dr. Jarvis, you can absolutely ask them within the question and answer function, and he'll be happy to address them throughout our hour together. So thanks so much for joining us.
Thank you, Karen.
Yeah, so as we transition our focus to workplace violence, I'd like to take a moment to just acquaint ourselves with the data. The most recent data available from the Bureau of Statistics reports that nearly 21,000 workers in the private industry experienced non-fatal workplace violence trauma in 2019, resulting in days out of work, of course. Of these workers, 68% were female, 65% were between the ages of 25 to 54, 70% worked in the healthcare and social assistance industries, and 21% required 31 or more days out of work. And according to the Bureau of Justice Statistics, over a 4-year span starting in 2015 to 19, there were 1.3 million non-fatal workplace incidents. As reflected in this table, the average annual rate of non-fatal violent crimes across all occupational industries was 8 per 1,000 workers. But let's break that down by specific industry. As reflected here, you can see that the average increased to 15.1 in the medical field and 11.9 in education. Mind you, this data is pre-pandemic. Since the pandemic, violence in the workplace has been front and center. A news report is a daily occurrence. In our schools, teachers are reporting increased violence and advocating for more support. And Maine schools are not exempt. The recent shooting in Texas led to increased threats of violence across our state. In healthcare, we are seeing increased reports and threats of violence. Assaults are becoming more and more common. And again, our healthcare workers in Maine are not exempt. Today's panelists are leaders in the field, professionals like you who are working to ensure the safety of their employees, patients, students, and patrons. It is my pleasure to welcome Rand O'Leary to our panel. Rand, you have been a strong advocate for your employees' safety, and I'm certain there are many lessons that we can learn from you that can transfer to other industries. So thank you so much for joining us today.
Thank you, Karen. It's really a pleasure to be here, and it's an important topic, and I'm happy to speak about it. It's important to all of us. So I guess I'll start with kind of our approach to this and the compelling reasons why we've been focused in this area. We say here often to our staff that it is not a part of their job to be assaulted either verbally or physically by another employee, by a patient or a family member. And so we strongly support the U report we support. So we want our employees to report these incidents so that we can address them. We'll talk a little bit more about how we do that. So what's the compelling reason? Well, unfortunately, we see it every day. The number of mass shootings in the United States just continues to escalate. It's really part of the nightly news. It's certainly been getting a lot of attention in social media and some other areas. So we have to be prepared. We continue to see these episodes escalate in public places, and unfortunately that includes hospitals. And so that raises our concern on how can we really protect our staff, how can we educate them so that they're prepared to respond appropriately, and in some cases prevent these incidents from happening. Because we know providing a safe workplace is really critical to quality of care and safety of care in the hospital. The June shooting in Tulsa was particularly disturbing, where 4 people were killed on the campus of St. Francis Hospital. Was the 233rd mass shooting in the US since 2022. And that's according to the Gun Violence Archive. Victims have been both staff and also patients. So we have to protect ourselves. So the shooting at Tulsa also really demonstrates that we're very vulnerable in our healthcare facilities. We're an open organization, which means just like going to the mall or anywhere else, our doors are open. You may have to be screened, because of COVID, but before COVID and after COVID, we won't have the screening. Anybody can walk in the doors, come in to visit a patient, or if they have some ill intent, they could also come in our doors. So we've been encouraging, as I said, for our staff members to report these incidents of violence or inappropriate language or threatening behavior. And we're averaging about 1 reported incident of workplace violence per day. It's that prevalent in the organization. 210 employee reported events in the last 6 months where the patient was the offender or the aggressor. And almost 400 employee reported events in our fiscal year to date, which is about 11 months in now, where the patient was the offender or aggressor. So the numbers are high, partially because of the additional reporting. But the numbers are high because the incidents are high. And I guess the other thing I would add to the data is that we know that by and large, many of these incidents, probably the vast majority of them here, go unreported because our caregivers really want to take care of their patients, and so they often will underreport incidents of this nature. So we know that the problem is here, it's prevalent, and it continues to grow. So training is key, education is key, and a security presence that involves multiple layers is really important. So there's some acronyms in here that we use. MOAB is the Management of Aggressive Behavior. So this is how we train our staff to recognize the potential for violence, the potential for aggressive behavior. We're going to hear more about that later. How to protect themselves, how to de-escalate patients or family members or others who might be aggressive, how to recognize domestic violence when we see it, because we know that in those cases that the prevalence for additional violence is higher. How do we successfully resolve conflicts in a productive way to, again, de-escalate situations? Unfortunately, we have to practice active shooter drills, and we do those several times a year here at the medical center, something we didn't do years ago. But we know that if we're well prepared, and should something like this happen, we hope it never does, but should it happen in our organization, that our response and our timeliness and our rapid response will protect and save lives. We need to make sure that we are identifying early any workplace acts of violence in our organization that may be between employees or between family members and employees. And we know nurses are particularly on the front line. We have a number of nurses working here in the medical center, and they're directly on the front line with our patients and their family members. And so we know we need to report those things, again, to our leadership. We'll talk a bit about that in a moment. So security, I mentioned security is a layered approach. There isn't one thing that can be done to 100% protect us from these incidents of violence or aggressive behavior. It's really a layered approach. It includes having a security visible, present, well-trained. It's training our staff. It's using technology like door alarms and cameras to really make sure that we stay on top of things and we identify things early. We have access controls here so that doors remain closed that should be closed and locked. We have panic buttons within departments that are hidden so that they can be pushed in a time of need so that they can summon help. Smart badges and personal panic buttons that we have for our staff now, which I'm actually wearing one today. It's just a small button that can be pushed, and then there's immediate response so that staff are aware that someone is in trouble and needs some assistance, so we can get there early and try to de-escalate the situation quickly. We do use metal detectors and scanning machines, particularly in our emergency room, because we're prepared to, if a weapon is detected, that we know how to handle that and what to do for that. But we also have many, many other doors that are open where we don't have that technology because it's just, we're unable to support that on a larger scale. So we tend to focus those types of solutions to those areas where we believe there's the most risk. And then the patient behavior safety flag is something relatively new here. All of our patient information is on an electronic medical record, and we're able to flag patients who have had previous incidents of violence or aggressive behavior when they're in our facilities, so that we know and we can take appropriate safety precautions so that we're aware that this patient may have the prevalence towards violent behavior. Next slide. So what can you do to protect your employees? Well, we know that every business is different. Every plan is going to be different, but some of the key action items that we would recommend is really looking at and reviewing quite thoroughly the training that you provide your staff. Also the policies. I mentioned the You Report, We Support policy that we have here, which just simply states, if you report an incident, our guarantee and our commitment to you is that we will follow up. We will investigate and we'll make the appropriate changes as necessary to protect you. Engage your local law enforcement. We've been very fortunate here. Chief Hathaway and the Bangor Police Department have been very much a part of our process here. They've been our partners. We've been able to have some lunch and learning events, we call them, with the Bangor Police Department to help our staff learn and understand things they can do to protect themselves. We've had several meetings with the chief and his staff to talk about additional things we can do, things we can change here to make our organization safer. Training is critical, making sure that we train all the time and that we're constantly incorporating new information and things that we're learning from across the country as quickly as possible so that we can create a safe and secure place. We know that patients need to feel safe when they're in our facilities. It aids the healing process. This calmness, this calm healing environment is incredibly important. And so we want to make sure that we create that. We'll see a video here in just a moment. And we also want to make sure that we're constantly gathering and analyzing our own data so that we can continue to get better. So with that, I think we're going to show you a brief video. It talks about the calming environment that we've been working on. So there's no sound, so I can narrate a little bit as we go along, if that would be, Karen, would that?
Yes, why don't you do that,
Okay.
Rand?
So what we're seeing here is a family member who's in looks like an emergency room, probably setting, is in extreme pain. And because the patient's in extreme pain and their loved one is there alongside of them, that's creating additional anxiety within this young man as well. And he's escalating the situation by becoming increasingly more aggressive in both his language and his actions, which is further adding additional stress to the patient. So the nurse here is demonstrating how to calm the patient by using calming language, using empathy, and being as transparent and clear in her communication as she can, which does de-escalate and inform the patient and their loved one so that the patient can really focus on getting better and healing, and lowers their overall pain because they're not as anxious. So sorry you couldn't hear that. It is a good video, and it is very representative of what happens here on a daily basis and the actions that we're taking to really provide a better healing environment for our patients.
Thank you, Rand. And I think you did a great job narrating that. So just so you know, you did a great job, and perhaps we can.
I've seen it a time or two. So.
And I will say that that video is available on a external facing website, correct? So perhaps we can find a link to that video and put it in the chat so you all can save it and watch it with the sound after today's session, and certainly feel free to use it with your teams if it's helpful to you. I really appreciate your time, Rand, this morning, sharing not only your experience at Eastern Maine Medical Center, but your commitment to your employees' safety, patient safety, and the work that you've done has been tremendous. And we've taken so many of those lessons and expanded them across our healthcare system. So thank you so much for your leadership.
Thank you, Karen. It was my pleasure.
Yeah, absolutely. Appreciate it. It is now my pleasure to welcome Kelly Weaver, who holds a certificate of advanced study in school counseling and has served as a school counselor at both the elementary and secondary education levels. So welcome, Kelly, and thank you so much for sharing your knowledge with us today. And I would like to say that Kelly was a recipient of School Counselor of the Year for the state of Maine. So it's a pleasure to have you.
Thank you so much. Today, I'll be talking a little bit about risk factors and protective factors in schools for students. I think that one thing that's pretty important is to look at not only the individual signs, which I think is where communities usually go to, but then also to look at the system involved there as well. So on the left side of your screen, you'll see that that would be the system, right? And on the right side would be the individual. So some of these I don't think would be a surprise, right? Like under-resourced schools and communities do have higher instances of violence. Drug and tobacco use, probably also not a surprise there. There are a few things on this slide that I would like to talk about, though. One is under the individuals, we have a previous history of violence, weapon use, domestic violence, et cetera. This piece here can be that the student was actually involved in violence, but it can also be observed violence, which I think is pretty important when you're looking at domestic violence or violence in the community as well. So another piece here under the individual here is that social disconnection. And I feel like most areas of the community, when they look at school violence, do see examples of this social disconnection. However, when talking about social disconnection, that's a place where school staff and school counselors can really help. And I'll be talking about that a little bit in a later slide. On the left-hand side, when we're talking about systems, we've already gone through those under-resourced schools, the drug and alcohol. The next one is discipline practices. Any discipline practice that's inconsistent or overly punitive could actually cause a more dangerous situation. That is also involved with zero tolerance policies. Most schools across the nation are stepping away from zero tolerance discipline policies, and it's for a variety of reasons. One is that schools are required to support all different learners. So, for example, in a bullying situation, as a school, we're responsible to the target of the bullying, but we're also responsible to the aggressor and supporting them, their social skills, and their ability to problem solve as well. This helps someone as they grow into being an adult to have the skills needed to be nonviolent and to solve their problems without violence as well. In a workplace, however, it does send a zero tolerance policy does send a message about expectations for behavior. In a school, however, schools need to balance the context. For example, if a school put a policy out that said violence will not be tolerated, you will have a 2-day suspension if you hurt someone at school. It does make sense, and I think that at first glance that does seem like a policy that would make things more safe. But if you start to look at context, you could see that there's a quick degradation there. So for example, what if that student is 5 years old, right? What if that student has seen no examples of positive problem solving up until the time that they became 5 years old and are now in the school? You can see that it becomes the school's responsibility to give that individual student more skills, better support, and more examples of positive problem solving. I also want to go over protective factors as well, because there's a lot of ways that schools can look at a person in a system as being safe and proactive. So these are all of the things that protect someone from violence in a school. So under the system, so it's the communities, schools, and families, you can see that we have constructive strategies for dealing with problems, which I've kind of hit on already. But it is, in my opinion, as a school counselor, my responsibility to make sure that my students have a variety of ways to solve conflicts and problems. The third bullet there says school discipline that's consistent, firm, and responsive. I think you could also add the word restorative here. Some of the best situations that involve discipline involve allowing the aggressor to restore the harm that they have caused. Under the individual side, you can see that there are a lot of ways that individuals can be protected. So they might have aspirations for themselves that would help protect that person from violence. Good connection, if they have a high GPA, they're protected a little bit more. One that's interesting about halfway down is the consistent physical presence of a parent. The study there has to do especially with waking hours and sleeping hours. So having a parent at home and available to a student helps keep them safe as well. Finally, the last part there that down on individuals says social skills and problem solving skills. I just want to highlight again that if an individual has high levels of problem solving skills, they are protected a little bit more from violence. So the final slide that I have for you today are the things that I do as a school counselor that help protect my students from violence. So the first one is that I monitor and track sense of belonging in schools 3 times a year. That survey, it's exactly the same survey 3 times a year. There are spots where students can identify safe staff members to go to if they needed help solving a problem. It asks about relationships with peers, relationships with adults. It also asks questions about self-concept and their idea on if they're able to solve their own problems or not. I need to collaborate with administration on discipline. restorative practices. A lot of this has to do with bullying, like especially in bullying situations. It makes sense for a school counselor to be there to support all of the parts of the bullying system. So that's aggressor, bystander, upstander, and target. Again, those proactive social skills are very, very important. Practicing problem solving, seeing it every day is important for students. Running a comprehensive school counseling program, which works with the 3 tiers of support. So I work with every student. That can sometimes look like a lesson plan or like an after school night, working with small groups of students on specific topics. And then finally working individually with like a small group of students who need it, the individual time as well. Finally, it's my job to build relationships with students, community members, staff, families. But more than that, it's really important to make sure that I'm creating situations where relationships can be built. No one person in any school could build the amount of relationships needed to keep a school safe. However, if we create systems and processes where relationships are built across many different parts of our school system, then it's keeping everybody safe. Thank you so much.
Thank you, Kelly. Thank you so much for the work that you do as well. You're protecting America's greatest asset, our children, and so really appreciate all of the work you do to protect them. So thank you. All right, our next guest is Amanda Cost. Amanda will discuss the impact of domestic violence in the workplace and share insights into what employers can look for to identify risk and take action. So thanks so much, Amanda, for joining us.
Thank you, Karen. I really appreciate you inviting me to be here this morning. And thank you all for joining us. This is such an important topic. And I'm sure many of us have been reading and hearing more about it these days. Just for a little bit more about myself, I'm Amanda Cost. I use she, her pronouns. I'm the executive director at Partners for Peace. Partners for Peace is the domestic violence advocacy center that serves both Penobscot and Piscataquis counties here in Maine, but we're part of a statewide and national network of domestic violence resource centers that are set up to provide support and resources to people impacted by domestic abuse and violence. And so sometimes this issue of domestic violence is not categorized as a workplace violence issue, but it very much is a workplace violence issue. It is often unspoken and unseen in the workplace, but then we know that many employees, coworkers, patients, and consumers are dealing with and experiencing abuse and violence. And so it's critical that employers and employees understand how domestic violence can impact the workplace. So just for some general knowledge about domestic violence, it is defined as a pattern of controlling and coercive behaviors that happens over a period of time within the context of an intimate relationship. And many of us know that it can show up in forms of physical violence and abuse, but it also is emotional, mental, and sexual violence. The pattern is a really important thing to mention because it's something that can build over time and be cyclical, and often can have moments of happiness and joy mixed with moments of fear and concern. So it's something that is sometimes hard to understand if it's not something that you've experienced. It's why it's so critical to be connected to the individual who's experiencing it to best understand what it is that they're going through. We know that domestic violence happens in all types of relationships, and all communities experience it at a higher rate. And our organization is available to provide services, again, to anybody who's been impacted by it, the victim survivor, as well as friends, family members, coworkers, employers. That's work that we do every day. I think sometimes when we have some strong instincts or gut feelings that somebody might be going through something, we're not quite sure how to put all the pieces together to then have a conversation with them to help them and support them. So I've put together on this slide here a couple of what we would call warning signs or indicators at our organization that are things that you can be aware of. This is not an exhaustive list. There definitely are a lot more things for you to be aware of. And as an employer, you could consider creating a list for your employees that might have some similar examples that people can be paying attention to. But on here I have, change in behavior if they're acting different than what you normally are used to. If you see frequent absences or call outs for work, unexplained or injuries or bruises that come along with excuses that don't seem to match what you're seeing. If their partner seems to be what we might call a helicopter partner, where they're always there, they're answering questions for a patient, if it's a patient that you're concerned about, or a consumer. It could be that this partner is the one who always has the answers. They're the one who calls all the time, or the one who shows up and visits, and it seems quite out of place and inappropriate. And then this last one, the heightened concern for consequences for their decisions. This is something that we hear from a lot of coworkers who've had people in their lives who've experienced abuse and violence. And they said they've noticed things like when they invited their coworker out after work, they couldn't go. Or when they were asked to stay late to do additional work, they were worried about the scrutiny that they would get from their partner. So these are some of the warning signs and indicators that you can be aware of. And when you start putting some of these pieces together, that's when you can start thinking about, okay, how am I going to approach this conversation? How am I going to talk to them about what's going on? And so on the next slide, I have some of what we would call ABCs of checking in when you suspect someone might be experiencing abuse and violence. And this is about sharing with them what you're observing. So I've noticed that you've been late a lot to work. I'm worried about you, what's going on? Being empathetic, supportive, and I would add to this, non-judgmental, because you don't know what's really going on. And if you approach it from a non-judgmental place, it can come across as way more supportive than if you're judgmental and critical of what you think may be going on versus what you want to learn is going on from the person that you're concerned about. And then this next piece about connecting someone to resources, that can be research. Do you already have a domestic violence in the workplace policy that you can reference to then provide additional support to this person or these people? It could be what are the community-based resources like Partners for Peace or another domestic violence organization. And 9 times out of 10, the person that you're concerned about already has people in their life who have been supportive to them or not supportive to them, or resources that they've reached out and tried. So you can also connect with the person that you're concerned about to find out what they've accessed for resources, what's been helpful and what not, and what has not been helpful. So on the next slide, just a little bit about the services that we provide at our organization, so that you all know what we do and what you might be getting into if you were to reach out or if you were to refer somebody to our organization. And we can just go through these animated points as I keep talking here. So we do have a 24-hour helpline. It's a free and confidential service. And on this slide, I have a 1-800 number. I think it's 866 number, actually, that's going to take you to our statewide helpline number. So if you're in a different part of the state and not in Bangor, you'll get connected to a local resource. But what we do through that helpline is we provide this non-judgmental, empathetic support that includes helping people access resources, figure out what planning for their safety might look like and what reducing their risks might look like. It also will include helping them access other resources within our organization, whether it's a shelter opportunity or a legal intake that might need to happen. We have a variety of services that we provide to victim survivors of domestic violence because it's quite a complicated situation and not just one thing is going to be what helps a person remain safe. So that is why we call ourselves a resource center, because we really value being able to provide all of the services that a domestic violence survivor might need from a trauma-informed lens. We also know that we can't do this work alone and that it is critical that domestic violence agencies partner with employers throughout the state. We've been in this organization, in this community for over 50 years now, and we've seen a lot of different ways in which businesses are impacted by domestic violence on a small scale and on a very large scale. And it's just so critical for people to recognize that it is something that can impact productivity within the workplace, of course, it impacts individuals' well-being, and it can impact the bottom line of businesses, and it definitely impacts our society's view on relationships and what is acceptable and what isn't. So all of those things are true, and we encourage businesses to examine what their policies are, and work with local organizations like ours to help develop policies and create resource lists for the people that you are employing.
Thank you so much, Amanda. This is information that all employers should have, right? And that 866 number is incredibly helpful because not all of our attendees today are in the region that you serve. So just a reminder that this information will be posted on our Northern Light Health website, so you can reference it after today's presentation and make sure that you're able to carry it forward and share it with others within your organization. So thanks so much, Amanda, for joining us today.
Thank you.
It gives me a great pleasure to now introduce Chris Laird. Chris is a trainer on de-escalation techniques, an incredibly valuable skill that can disrupt the progression of behaviors that lead to violence. So welcome, Chris. Thanks for joining us.
Absolutely. Thank you so much for having me. De-escalation is all about helping and improving a situation to limit barriers to that communication while reducing the risk of escalating a situation. I think everybody's done a great job so far of identifying some of workplace violence, what it is, how it applies to domestic violence. We're going to talk about that de-escalation and what we can do. I think while working with somebody who is escalating, it's important to make sure that we're empathetic and non-judgmental. When someone says or does something you perceive as weird or irrational, try not to judge or discount their feelings. Whether or not you think that those feelings are justified, they're real to the other person, so we want to pay attention to them. We also want to keep in mind that whatever the person is going through, it may be the most important thing in their life at that moment. When talking to somebody, we want to make sure that we're using non-threatening nonverbals. The more a person loses control, the less they actually hear your words. They are more likely to react to the nonverbal communication that you display. You want to be mindful of any gestures, facial expressions, movements, and the tone of your voice. You want to keep your tone and body language as neutral as possible, and that will go a long way to help towards diffusing a situation. We also want to make sure that we give them space. We respect their personal space. If possible, stand 1.5 to 3 feet away from the person who's escalating. That allowance for personal space tends to decrease a person's anxiety, and it can help you prevent from any acting out behavior. It also helps to make sure that you're safe as well. If you must enter someone's personal space to provide any type of care, explain your actions so that the person feels less confused and frightened on why you're entering their space. And I think it's also important to set limits and boundaries. If a person's behavior is belligerent, defensive, or disruptive, we want to make sure that we're giving them clear, simple, and enforceable limits. Offer concise and respectful choices and consequences. A person who's upset may not be able to focus on everything that you say, so you want to make sure that you're clear, that you speak simply, and that you offer the positive choice first. Next, on the next slide, we're going to talk about some nonverbal and verbal techniques. There are several of them that are here. I think most importantly, we want to make sure that we avoid overreacting. We want to remain calm, rational, and professional. While you can't control the other person's behavior, you can respond to their behavior. How you respond to their behavior will have a direct effect on whether the situation escalates or whether we can help to diffuse it. Positive thoughts like, I can handle this and I know what to do, will help you maintain your own rationality and help to calm the person down. And you want to focus on feelings. Facts are important, but how a person feels is truly the heart of the matter. Some people have trouble identifying how they feel about what's happening to them. So we want to watch and listen carefully for the person's real message. Try saying something like, that must be scary. Supportive words like these will let the person know that you understand what's happening and you may get a positive response from them. You want to ignore challenging questions Answering challenging questions often results in a power struggle. When a person challenges your authority, we want to redirect their attention to the true issue at hand. Ignore the challenge, but not the person. You want to bring their focus back to how you can work together to solve the problem. The goal for all of this is, on the next slide, conflict resolution. We want to choose wisely what you insist upon. It's important to be thoughtful in deciding which rules are negotiable and which are not. For example, if somebody doesn't want to take a shower in the morning, you can allow them a choice. Do you want to do it this morning? Do you want to do it later today? Allowing them to choose the time of day that feels best for them can sometimes help to de-escalate that. If you can offer positive options and flexibility, you may be able to avoid unnecessary altercations. Allow silence for reflection. We've all experienced awkward silences. While it may seem counterintuitive to let moments of silence occur, sometimes it's the best choice. It can give a person the chance to reflect on what's happening and how he or she needs to proceed. And believe it or not, silence can be a powerful communication tool. We want to allow time for decisions. When a person is upset, they may not be able to think clearly. You want to give them a few moments to think through what you've said. A person's stress rises when they feel rushed, so allowing that time can help to bring calm. We want to make sure that we're prepared to listen. Don't be judgmental. Don't ignore the person or pretend to be paying attention. Listen to what they're really saying, restate that message, clarify the message, and repeat the message. There's a lot of resources online to help support different tips and tricks for de-escalation. And it's often something that needs to be practiced to build comfort with it. De-escalation is something that we can do on a daily basis in many different ways. So practicing that will help you when areas truly kind of escalate and you need to step in. Thank you so much.
Thank you, Chris. Lots of information that you just shared with us in a short span of time. So please don't hesitate to reach out to Chris if you'd like to have more information. I know he's more than happy to assist you to navigate all of the various resources that are available. So thanks, Chris.
Thank you.
So at this time, I'm very pleased to invite all of our panelists to turn on their cameras as we transition to the question and answer portion. And I knew we would have so much information to share with you today. I was worried we wouldn't have a great deal of time to ask questions. I'm very pleased to see we have more than I anticipated. So please don't hesitate to use the question and answer feature within our conference to ask questions of our panelists today. And I will start with my first question is for you, Rand. You had mentioned that your organization on average is now receiving about 1 report of workplace violence per day. And you've also mentioned that in your policy, you've made a commitment that every report is going to be acted upon, it will be addressed. And so curious to know what your process is for reviewing that and how you're resourcing it at the Eastern Maine Medical Center.
Sure, thank you, Karen, for the question. So when an event occurs at Eastern Maine Medical Center, the first and most important thing for us to do is make sure that we have a safe situation. So the safety and the immediate needs of all those involved, patients, families, staff, is addressed by local leadership, people that are present in the department, on the floor, wherever the incident happens to be taking place. So first of all, make sure everyone's safe, situation is secure, and that there's no further harm. The event is then reported through an internal system that we have that involves other leaders. We encourage those reporting to document as much as possible what happened, how it happened, what was done in the moment to address the situation. We then respond as a leadership team. In some cases, we interview witnesses. We look at any available video. We're fortunate here. We have cameras really everywhere. There's almost no areas within the organization that we don't have some video available to help. Sometimes it's hard to remember, when things are happening in the stress of the moment, exactly what transpired. So the video can be very helpful in that. We involve our patient safety officer and our risk managers as well to help us take that information, look at the data, look at everything that's available, and then recommend some improvements going forward so that we can avoid a similar event in the future. And then finally, we close that out with clear and consistent communication back to everyone that was involved, so that they understand what happened, why it happened, and what we're doing to prevent it in the future. And then we also have a workplace violence prevention team as well. And this information is also shared with that team so that we can continue and further learn, so that we can spread potentially a best practice to the entire organization, and also across all of Northern Light Health, so that we can make sure that we're sharing what we know when we know it, so folks can stay safe and avoid similar incidents in the future. So thank you. Good question.
Yeah, great. Thank you, Rand. It sounds like you have that process very much standardized and the expectations clearly outlined. And so really appreciate you sharing that with our audience today. I'd like to toss the next question over to you, Amanda. Actually, I believe we were messaged, the panelists only, by one of our participants audience members who mentioned a reference to state law about an employer's obligation to support employees of domestic violence. And so do you want to speak to that a little bit more?
Sure, I'd be happy to. I'd love to talk about it a little bit more in the context of developing a good policy, workplace policy. And one of the things that I would recommend is that the employer understands their obligation, as Carol was saying, to provide adequate leave for victims of domestic violence, for court hearings, if that's what they have coming up, related to leave that they might have for medical needs as a result of the violence that they've experienced. It's not only good for the victim, survivor, and employee that you know that those are the benefits, but it's also good for you as a business. It helps to establish a culture within your business that demonstrates that you are supportive of the individuals who are experiencing abuse and violence, and that's critical. So Maine is advanced, I would believe, in its thinking around time off in general, and certainly time off and available benefits for victim survivors, including if someone has to leave their job as a result of domestic violence, being able to allow them to seek unemployment to support their income if they've had to leave.
Thank you. I honestly didn't know about that. So I appreciate the audience member bringing that to light, and Amanda for providing more information about that and guidance for today's audience. So greatly appreciated. Kelly, I'd like to talk to you a little bit about the interventions that you're using within the school setting. You referenced in a couple of your examples, a 5-year-old or a kindergartner, most likely. And I'm curious to know if the intervention, particularly using restorative justice, which I know RSU 22 uses, if that is as successful as the child ages, or are you finding that you're having a less ability to curb tendencies towards violent behavior as the child gets to secondary education?
Thank you for that question. I think that it's hard. It would be hard to be a counselor or an educator without believing that people can ultimately change. So I do agree that the best way to have proactive interventions, social skills training, restorative practices, et cetera, would be throughout the entire life course. Those interventions would be best if they were provided early and often, and then revisited throughout a student's time here at RSU 22, and then again as an adult. However, I do think that if just because someone didn't get the interventions early doesn't preclude them from being successful later on, but it does get a lot trickier as students get older and transition into being adults.
Appreciate that. I mean, we have seen in the news reports, unfortunately, of the school shootings. Many of them are of these are teenagers or former students, and so it does call into question how effective are these strategies, or perhaps these strategies weren't used and it was a missed opportunity, right? So, thank you. Do you have anything to add? I didn't want to cut you off. It looked like
No,
you
I was just going to agree with you. Thank you.
All right, great, thank you. Amanda, curious to know, we've heard in the data, we've seen in the data, and certainly in the news, there's more reports of workplace violence since the pandemic. Are you seeing those same trends within the reports of domestic violence?
Well, when we first went remote and everybody stayed at home, we thought that our numbers would increase dramatically. And we were shocked that in the first few months of the pandemic, when it was still kind of cold out, especially here in Maine, our numbers went down. And we had prepared all these resources and staffing, and we were shocked. And so when our numbers started jumping back up again, what we heard from survivors is that it wasn't safe for them to be calling us because they were isolated in their homes. They couldn't go to a family or friend's house or even their job and reach out to us. So they were being really creative and going out in the garage and pretending to clean their car when it got a lot warmer. So then they could reach out to us and ask for support. I would say our numbers have been pretty steady since then until just the last 6 to 8 weeks. And it has been the busiest I have ever seen us in the 23 years that I have worked here. And I believe that has a lot to do with the housing and transportation crisis and people's access to mental health support and services. And I think through the pandemic, we did a really good job supporting people and asking for help and services. And so I don't think domestic violence numbers have gone up. I think people reaching out is more acceptable, and I'm appreciative of the pandemic for that part. And I also think that people are stretched right now as far as how they can, where to turn to, because there are not enough resources and supports for people around particular things, especially housing and transportation. And we're working through that every single day.
Wow, that's incredible. I appreciate that. That's certainly something to think about. And you have me reflecting and pondering what you just said. So appreciate that insight, Amanda. So we have a question for you, Kelly. Do you think that any interventions used in the school could be used in the employment realm for bullying behaviors? So can that be transferred to an employer that's not within the school setting, do you think? Some of those strategies?
I think that definitely that could be possible. I know that restorative practices are provided to a variety of different professionals, not just those in schools. I'm not an expert on them at all, but I know that training is out there. I also think that if you look at social systems and you look at bullying systems, those are also used by adults, right? So if you did receive training in bullying as a workplace, I think it would benefit you to just understand the background, the systems approach, et cetera.
Great, thanks, Kelly. So we have time for one more question, and I'll ask it of each panelist, and they can be as concise as they can be because we're almost out of time. But for today's audience, if today's audience could leave here and implement one thing to help prevent workplace violence, what would you recommend? And we'll start with you, Chris.
I think if we had to pick one thing, it would be keeping workplace violence in the forefront of your thoughts, looking for some of the identified behaviors. I know Amanda talked to some of them, but truly looking to see what areas are out there and making sure that we have those abilities to be able to de-escalate and prevent anything from occurring. So just being aware of it, keeping it in your forefront, and kind of going from there.
Thanks, Chris. How about you, Rand?
I would double down on that. I would say training to increase your awareness, to understand when you're in a situation where the potential for violence is there, and then how to protect yourself, or as Chris was saying, de-escalate the situation so it doesn't happen altogether. So training.
Thanks, Rand. Kelly?
From my perspective, I think it all has to do with relationship and explicit instruction on problem solving.
Thank you, Kelly. And Amanda.
Collaboration was something that came to mind for me, and I think something that each one of the speakers mentioned today. None of us can prevent it or intervene without collaborating with another coworker or a boss or a outside agency or whatever it might be. So mine would be make sure you are aware of who you can collaborate with to address the issue.
I love it. I love all of those answers. I love that they're all different and offer something different for today's audience so they can see and think about what might work for them. So thank you to all of our panelists for joining us today. Just a reminder, you can find recordings of all of our Zoom conference, including today's, on our Northern Light Health website. I hope this hour has been a help to support you, your employees in our communities. And just a reminder, we will be emailing you a survey right after today. Please be sure to give us your feedback so we can continue to provide relevant information. Our next session will be October 6th, when we address the health headlines and discuss women's health with a specific focus on breast cancer awareness, prevention, and how employers can support employees to seek these services. So you don't want to miss it. We will send you the registration link. Please register. Please share the invitation with your friends and colleagues. And we hope you're able to join us. Thank you and have a wonderful afternoon. And thank you, panelists, again for a great hour.